If you've been told that you might need coronary bypass surgery, you're going to feel quite overwhelmed, and that's completely understandable. It's a big moment in anyone's life. It's a major life event, and naturally you'll have lots and lots of questions. So today I'm going to talk to you about what bypass actually is, why it's needed, and what it does for you in terms of your recovery, your symptoms, and your long-term future. My name is Inderpaul Birdi, and I've been treating patients with coronary disease for, 30 years, and increasingly performing minimally invasive procedures to help patients with this particular condition. But let me start by explaining what coronary disease actually is. Over time, in some patients, not everybody, the arteries that supply the blood to the heart muscle can become blocked or narrowed. This is because of buildup of fatty deposits in the heart arteries called plaque, and they can over time become obstructive. Now, when these arteries become too narrow, the heart muscle may not receive enough oxygen, and especially during exercise or stress, one might feel symptoms. These could be chest pain, angina, shortness of breath, or just simply fatigue. In more severe cases, of course, what can happen is a patient can have a heart attack. Coronary bypass grafting, or CABG for short, is a surgical procedure that really improves the blood flow of the heart by creating flyovers over the blockages in your native arteries. We don't take them out. We give you a new set of arteries to give you a better blood supply to the heart muscle and therefore prevent heart attack, improve your symptoms, and make you live longer. Now, we take healthy blood vessels from behind the breastbone, the left internal mammary artery, from the forearms, the radial arteries, and also from the legs. We call those saphenous veins. Arteries always last longer than veins, and so we prefer to take arteries whenever possible. Now, the traditional procedure is one where we perform a sternotomy. We open the breastbone and winch it open. This allows full access to the heart, but of course it means a longer recovery time, more pain, a higher risk of complications like wound infections, bleeding, and in people with diabetes or weakened immunity, infection can be a problem. And if the infection gets in the bone, it's a big deal because the bone never heals. Now, I want to reassure you at this stage, sternotomy bypass grafting is a very good and very reliable operation. But in certain patients who are suitable for minimally invasive procedures, an operation done between the ribs on the left-hand side, either to graft 1, 2, or even 3 or 4 arteries, when that surgery is performed by experts in the right patients, the results can be superior to sternotomy. And that's really what we're going to talk about in subsequent videos today. If we've done our job correctly, we will not only have allayed any anxieties you have about this treatment, we'll make you understand why it needs to be done and what your long-term future looks like, and how we would assess whether or not you particularly could be suitable for minimally invasive surgery.